Okay.
Okay, ladies and gentlemen, welcome, and we're going to call the Rutherford County Benefits and Insurance Committee meeting to order. I've received a copy of the minutes of our last meeting. I hope you have read it and reflected on them. Do I have a motion considering the minutes? Motion to approve. Do you have a second? Second, Commissioner Jordan. Did anyone have any corrections or additions? If you didn't, then all in favor, please say aye. Aye. Any opposed? All right, thank you very much. Now, Ms. Stinson, you may tell us about our financial condition.
If you refer to Fund 264, we will begin with that report. For the month of July, our per employee per month for our Cigna self-funded claims is $885.03. When we combine our on-site medical experience for the month of July, our per employee per month increases to $927.26. Prior year, our total per employee per month, which included both the Cigna self-funded claims and on-site medical, was $955.92. So we see a 3% decrease as we begin this fiscal year.
But 1 month does not necessarily reflect a trend, correct?
No, sir, that's correct. Although I wouldn't mind that trend continuing, I don't think it may. Moving on to Fund 266. For July, we were at $44,509.52 compared to prior year of $74,775.16. So again, a decrease for Fund 266 as well.
Okay, are there any questions regarding that good report? Okay, if not, then we will continue with the workers' comp and OJI statistics, and Mr. Good, you will be telling us about that.
Good afternoon. I'd like to report for the month of July that we had a total of 8 injuries requiring medical attention. You can see the breakout there on your report. That brings the total for the year up to 96. Of those 96, 70 of them are OSHA recordable. 48 of them had restricted days. 12 had lost time days, and 10 were considered other recordable. Total incurred dollars for those 8 right now is $30,195,000. And 6 of those injuries were with the Board of Education, and those dollars incurred for those 6 were $26,295. The County General had the other 2 for $3,900 worth of incurred dollars. And then on your next page of your report, you'll see where those 2 for the County General were. And then the last page of your report is the total incurred dollars. And right now this year we're at $196,512 incurred total for the first 7 months of the year. But just like again to always remind you, those dollars have not matured yet because they're only some of them are only a couple of months old, and it takes a few months for those dollars to incur. Are there any questions?
What there, sir? No questions. We will continue this discussion. Okay, Mrs. Stinson, wellness update.
Ms. Perrin is not here today. She's participating in the Healthiest Employers Luncheon, where Rutherford County is nominated as one of 5 finalists for our category. So we'll learn more about that next month as to who that award went to. During the month of July, Wellness on Wheels conducted a screening and awareness at the county clerk's office. We had 8 in attendance. That represented 89% of that department's participation. We also participated July the 30th and 31st at the Common Core Conference with the Board of Education. That is an annual event that we look forward to. And it gives us great access to the employees and gives us an opportunity to educate them about our MedPoint clinics, our Wellness on Wheels program, and other wellness initiative and offerings that we have. From that conference, we had 318 individuals stop by the table and meet with someone, and we had 23 Board of Education employees indicate that they would like to be a wellness site champion for their school. So what that means is our wellness coordinators will reach out to them as different events are scheduled at their school, like a Wellness on Wheels, and they will be the voice for that program with their peers, and so that's a good contact for this. The wellness coaching for the month of July, we had 19 total individual wellness coaching sessions representing 19 active patients and 29 coaching visits for the month of July. In the month of August and September, we have several upcoming events. We have a lunch and learn at the Farmers Market on August the 23rd. Our September Fitness Challenge is a countywide challenge that begins on September the 9th and runs through October the 4th. Emails have already gone out about that. We have Kids' Choice Mini Pizzas as a healthy cooking class on September the 10th. Lice Services is offering a webinar of Suddenly You're a Caregiver on September the 17th. There's a 5K family fun run, a Rally for Recovery, which is part of Drug Court and their program at the Gateway on September the 21st. And one of the most important events listed here is on October the 11th. That is our annual Rutherford County Employee Wellness Fair, where we offer many annual screenings, as well as we will offer free flu shots as in years past and biometric screenings at this year's event. That's October the 11th from 3 to 7 p.m.
Okay, are there questions? And I did hear you on the last one, at the Wellness Fair at the Lane Agri Park, you are going to offer the biometric screenings?
Yes, sir. We had discussed at the last insurance meeting the wellness fee beginning in 2014, and we walked through how employees would have to have a lipid panel sometime during 2013 that was passed by full commission, and we will be sending out information as to how to obtain that, what's required, the impacts of not participating, so basically the who, what, when, where, and why, to employees at the beginning of next week. And it will give them all the information as to what the screening involves, where to get the screening, and we are offering this at the Wellness Fair to provide greater access. We typically give around 300 flu shots at the Wellness Fair, so there's 300 more people that can go ahead and get their biometrics if our numbers remain consistent. So we'll be staffed to do that. Fasting is always preferred on this biometric, but you can have the biometric non-fasting as well. So we can accommodate either one.
Ms. Harvey?
Okay, to do the biometric screening, is that blood work? Is that what you would do to get the cholesterol?
Yes, ma'am, that's correct.
So those people that have that done, how will the results be given to them? Will they get something in the mail, or how will they be informed of their numbers?
There will be outbound from the MedPoint clinics to anyone who has negative results. And Ms. Asher-Branner, if their results are positive, if it's positive for anything that is elevated, then they will have an outbound call. If it's negative, will there be anything sent to them?
Yes, there will be information that will be provided in a letter letting them know that the results are there. They will also be available on the portal, either via secure messaging or in their lab profile.
So what she has said is that it will be available through the portal, just as it is today, and then there will be a letter mailed to them as well.
So with a follow-up question, if you do not currently have the county insurance, will you be allowed to have this screening done?
Not if you do not currently have the county insurance, no.
Okay, any more questions regarding wellness? Okay, next on the agenda is MedPoint Employee Satisfaction Survey, and Ms. Mary Asher-Branner, I may have said that correctly, from Take Care is going to tell us about that.
Good afternoon, ladies and gentlemen. Thank you for allowing me to present the patient satisfaction survey results for the Rutherford County MedPoint Clinics. This is some good news that I wanted to share with you guys. On the first slide, I've got just an overview of just basic information that the patient surveys that we do are tallied by Sullivan and Llewellyn. This is a company that provides surveys for national companies. It is as standardized questions, okay, for national comparisons. And this allows for benchmarking for outside of Take Care as well as inside of Take Care, which we feel like is very important. Patients are asked to complete the survey during a 4-week time period. That is, everyone that comes into the clinic during that time is asked to complete it. It's put into a box, and the surveys are not shared with the clinic staff until after the results are received. On slide 3, you have the overall highlights. And I've also included from May of when we did the first survey in 2012. And you remember we started with the clinics in September the 1st of 2011, and the survey was done May the following year. The overall mean of all of the questions, the overall average was a 4.51, and that is on a scale of 1 to 5. So that rated very high overall for the very first year. There was no single item that measured less than a 4.0. And when I saw that, when I received that first one, I was grinning from ear to ear, and they had a hard time keeping me from jumping up and down. Okay? I was extremely tickled. Our sample size that first year was 201. 72% of these were established patients that responded, okay? And then 22% were new patients, so that was a good overall comparison through. Now let me give you a little story about this year and when I received the results for this year, because I think it's important I share that with you. We're doing an outreach at Stewart's Creek, and all of a sudden across my pager, I get an email that says, patient satisfaction results have been posted, and I say it out loud. And when I say it out loud, everyone of the team members in the clinic immediately stops. I mean, it was just literally, you could hear a pin drop. And I turned around and I said, the patient satisfaction surveys are in. I need a computer. Corinne said, here, mine. I've logged out. Log in. Here's a chair. Sit down. And so for the next few minutes, we were literally pulling the surveys, okay, as we went through. And the more that I pulled and the numbers that I saw, I was grinning. They got to see me almost jump up and down. I don't think that anyone in the clinic has seen me that pleased with the results. I was so excited. And this is why. So on this slide, our overall mean this year was a 4.76 on a scale of 1 to 5. That's huge. That is really huge. No measured item scored less than 4.22 on a scale of 1 to 5. Okay? The sample size was 225. 76% of them were established patients, and 18% were new patients. So we are very pleased with those overall results, just tickled to death. So the last slide here is the overall categories of what we are comparing to. And remember, I told you that it was done by Sullivan Llewellyn, who totals and tallies in their national questions. So when your appointment, and it's asking about the ease of the appointment, the availability of appointments, and things of that nature, we went from 4.41 to 4.74 this year. The Take Care Health score was 4.66. That is what Take Care Health's average is internally, okay? So we were higher than Take Care Health overall average, and yes, I've been rubbing these numbers in. The national score was 4.39, so we're exceeding the national benchmark on that. Our staff, and it was rated at 4.71 last year and is rated at a 4.90 this year. Huge. The Take Care Health benchmark was 4.82, and then the national score is 4.62. Our communication was at 4.48 last year, and it is 4.74 this year. Still, we are exceeding Take Care Health score and the national score. The visit with the provider, and this is about the conversations that you have about what the provider shares and how they respond to your care, is 4.64 4.3 in 2012 and 4.85 this year. The Take Care Health score is 4.78, and the national benchmark is 4.66. Our facility, and it is the facility line that we actually rated those line items, so we're at 4.22, okay? Was at a 4.35 last year and a 4.64 this year, with a Take Care internal score of being 4.66. This one does not have a national benchmarking equivalent to it because it is specific questions that we ask about our facility. And then overall satisfaction was 4.50. This year it went to 4.80. And the Take Care Health score was 4.74. So overall, I am very pleased to share these results with you on it. I think it says a tremendous amount about the services that are being provided, the skills and the caring that our providers are also providing the employees of Rutherford County in their health care. Any questions?
If there are no questions, thank you very much for a very excellent report.
Ms. Asher-Brenner, do you have someone with you today you would like to introduce? I see a guest in the audience.
I do. Dr. Dooley, would you please come forward? And Suzanne, would you please come forward? I do have a couple of guests in the back of the room with me. We have a new medical lead at the MedPoint Clinics. Her name is Dr. Tansy Dooley. She is locally. I'll have her tell us just a little bit about herself. And then also Suzanne Vidion is the manager of the MedPoint Clinics. Dr. Dooley?
Okay. Okay, thank you for meeting me today. I am Tansy Dooley. I am actually a native of Tennessee. I was actually born in Nashville, Tennessee. Was raised there, went to public school in Tennessee. I actually went to college in Virginia, came back to Nashville, went to Meharry Medical College, which is the alma mater for my parents, and received my medical degree. I actually trained in Florida at the University of Florida. So that was an exciting experience, but once again, I came back to Tennessee in 2002. Whew, sorry, I got a short breath. I came up those stairs. And I actually had a practice here in Murfreesboro for about 9 years. I just recently joined Take Care Health Systems. I'm really excited to be there. I really like the model, and I'm just tickled pink to be here with the MedPoint Clinics. My biggest role and most of my activities the last 3 months, I've been here since about May, June, has really been working with the nurse practitioners to make sure we're meeting all our treatment guidelines, making sure our patients get good care. So I'm just excited to be here. So it's nice to meet you. I'm going to let Suzanne come up.
Hi, I'm Suzanne Vidion, and I'm originally from Palm Beach County. I moved to Rutherford County about 26 years ago, and I joined Take Care Health in January 2nd of this year. So I'm the health center manager, and I'm enjoying it, learning things every day, and it's nice to meet everyone.
Ms. Asher-Brenner, we also have a part-time physician that works as well on our account. If you could just talk briefly about that.
Yes, we do. Dr. Lane Tippett is also providing services at the MedPoint Clinics. He is there 10 hours a week on Thursdays, so we do have one full-time physician, one part-time physician, and then the nurse practitioners do the staffing for the other.
Thank you very much for that good report, and thank you, ladies, for your service. We appreciate it very much. Okay, we have next your Health First Comprehensive Analytical Report, going to be presented by Jean Crane with Cigna.
Herndon, I put Crane, I apologize.
Oh,
Herndon,
what?
I apologize. Yes, I did. I used to work with Jeannie Crane, I just made you her.
What is her last name?
Herndon.
Herndon. Well, please excuse me. I
That
just
was my
read what
mistake.
is
I
written.
apologize.
Hey.
I did it.
Hello, everyone. I'm Jeannie Herndon. I think I've met most of you in person. If not, I'm sure you've seen me around. I am taking over the health advocacy reports from our client manager. So I sent Melissa the current period report, which is from January 1, 2013 through June 2013. and she wanted me to share just a highlight of those reports with you guys this morning. So I think you had in your package a copy of the Consultative Analytic Report, and that is what CAP stands for. And this is a report that shows us the results that we're getting from the health advocacy, health wellness programs that we have in place for Rutherford County. So first of all, let me explain what the Your Health First program is. It is a health advocacy program that uses a holistic approach that weaves all of the health issues affecting an individual. So that allows them to have one coach to help direct them with everything, and it brings together their lifestyle, social, and behavioral support. So it's kind of a well-rounded one access for the employee, which helps them just to have one person to deal with. So the Your Health First program does a couple of things. It recognizes worsening conditions and can advise the member when it's appropriate to see a doctor. Sometimes people may have symptoms and conditions, but they don't realize that it is so bad that they do need to see a doctor. So the health coach can help them recognize when they need to go seek care. It establishes questions for the employees to have to ask their physicians when they go for their visit. And it helps coach them with healthy habits like sleeping, eating, exercise, nutrition, and things like that. So that's what the Your Health First program is. So what I'm going to do is just give you a highlight, an overview of what the report has inside. First of all, we're going to go over the overview of the entire report. And the report shows that 28% of the population has some type of condition that warrants wellness coaching, and 20% of the population has been identified for outreach in the current period between January and June. Of those identified, 50 have tried one or more clinical touches, and the top clinical touches include 40% receiving a mailing, 12% were involved in a telephonic coaching, and then 4% experienced utilization management. 13% of those identified in the report engaged, or 15% of those who were reachable were engaged, and 6% of those identified were engaged in an ongoing basis on a telephonic program, or online, or some other type of means by touch. 292, or 2.3% of your individuals were identified with inaccurate phone numbers, which makes it very difficult for us to reach out and help them. So we need to try and get more accurate phone numbers if we could. And then 363, or 2.9%, were identified as not wanting additional information. So anytime a member gets a call from the health advocate, if they do not want to participate in any of the programs that are suggested, all they have to do is just say, "Take me out, I do not want any help." So we take them off the call list. So it's not like we're forcing this program on them, but it is good to promote these programs because it does help a lot of individuals. The identification and ongoing engagement, which talks about chronic conditions, wellness and lifestyle coaching programs, and then case management, and it also includes any online coaching. So of those types of issues, in the current period, predictive models have identified 28.4% of the population has an issue, has a problem. Of those identified for outreach in the current period, 5.9 are engaged in an ongoing way, meaning they either agreed to participate in a telephonic or an online coaching program. Chronic conditions, and you'll see a list of the chronic conditions on page 5 of the report. In the current period, predictive models have identified 25% of the population with a chronic condition. And a chronic condition is identified as asthma, COPD, cardiac. The major chronic conditions are included in this program. So 25% of your population has some type of a chronic condition, according to the claims and the online information that we're getting. So of those identified for outreach in the current period, 6.1 are engaged in an ongoing way, meaning they agreed to participate in that telephonic or online coaching program. Now, on the lifestyle, wellness, and treatment decision report section, this section identifies an engagement are broken out per program on page 6, and it breaks it out between our lifestyle management program, which is the weight, stress, and tobacco. And then the wellness programs are the online programs that we have available, and that deals with stress, nutrition, tobacco. There's a whole list in the report. So 297 individuals were identified for stress program, tobacco, and weight, lifestyle coaching. And of those identified, 87 are in ongoing engagement. Now, you might say if 297 were identified and we're only reaching 87, that is good. That's 87 people that we're helping change a lifestyle or a habit that's going to give them a better health. So even though that number may seem low, I'm still proud of that 87 because that's good. Out of the identified, 1,758 were identified for the online wellness coaching programs, and those are the online-only programs, and it deals with weight, stress, tobacco, physical activity, those type of programs. So of those 1,758 identified, we have 112 in ongoing engagement in those online programs. 287 were identified for treatment decision support, and treatment decision support covers certain conditions like hip replacements, knee replacements, cancer, and I think those are listed on page 5. No, they're listed on page 6 at the bottom. So 287 individuals were identified for the treatment decision support, and of those identified, 19 are in ongoing engagement with a health coach. So that, in a summary, is what your health advocacy programs look like right now, and we will continue on a quarterly basis to pull this report to see if we are improving and maybe work with Kelly and Melissa and Mary at MedPoint to try and see how we can get the word out on these programs and how they work to your employees. Anybody have any questions? It's every employees and dependents, spouses, yeah.
I think it's important to note that with the biometric screenings that we will begin promoting with our employees, that the results from that actually feed into this program as well. So what you've just seen is, we talked last month about 600 plus people have already had the screening that we talked about. Some have had expanded labs beyond that. Their results fed into this program. And of that type of information that feeds through Cigna, this is what has been identified to date. We will continue to see these numbers grow as we go into the biometric screening process. And our employees, as you can see from some of the statistics, actually have an interest level in receiving this type of support based on the numbers that have been provided to us today. So,
As you guys move more into your wellness program, this is a great partner for that program, and we definitely want your employees to know that if you'll notice in this report that Melissa gets, there's no personal information, there's no identification of employees. It only takes the claim data that we have captured in our system, and it compiles it into a report that lets us know what our focus needs to be and how the programs are being utilized. It's private and confidential.
I have one question. On page 3 of your packet, where it says engagement outreach detail, and I understand what self-managed means, I think I do. You've got prevalence of 3,565, and you've got self-managed 1,106. Is that where so that's saying you've either contacted them and they're self-managed, or you deemed they were self-managed?
Paul, doesn't that mean on self-managed, doesn't that mean that it is something that the employee has been coached on and they're in the self-management process? Is that what that means? It's not driven by claim data. It may have been someone that took the online health risk assessment, and then they have on their certain areas of that will give self-reported issues. That could mean that too.
Questions or comments? Mr. Sandvig?
Ms. Stinson, would you just give us a recap? And I know some of this was before your time when we started the HRAs and similar issues that we will be finding with this program, some major health issues that were discovered by some of our wellness initiatives that people were totally unaware of.
Right. So with an HRA, it's not uncommon to identify those that are diabetic or who are borderline diabetic, those who have other risk factors. It could be their BMI levels are too high if they have testing done like that, all contributing to chronic disease management. And there have been instances where even in our own health clinics today, as people have presented in, we'll do an initial screening and see that they need a higher level of care immediately, and we'll refer those individuals out and get them scheduled into a specialist. So anytime that we do the HRAs, those are the type of individuals that we identify, much like what she has here. I think it's on page 5, which is the top 5 that we have, which is the diabetics, the high blood pressure, the cholesterol, COPD, congestive heart failure. Those type of patients will present themselves through the HRA process, and that is indicative of what we've seen in this report as well.
So all of these people were identified through the HRA process, is that?
The HRA process will typically involve some type of lab component to it, and it's the lab component that feeds data in that produces the report that we've had presented today. The actual HRA, the health risk assessment, is the self-reportable component that she alluded to in response to Ms. Stevenson's question. So that is, what is your environmental factors? Do you wear a seatbelt? Do you exercise? Do you smoke? Do you do some of these other things? Those are the self-reportables that we mentioned.
Okay, thank you very much for that report. And again, this is just one of the many pieces that we're trying to put together to help people improve their health, to benefit them very much. So. Okay, that's all we have on the agenda. Is there any other business? Mr. Sandvig.
Okay, I'm sorry, I wasn't sure I'd flipped the right way. I was wondering if, and yeah, this being August, but maybe by next month we could come up with the date range or some thoughts on a date range for next year's wellness measurement period, like if it's blood work, the dates we'll be looking at. So maybe we could get that word out along with our open enrollment and all. So
For 2015, you're asking us to go ahead and communicate?
yeah, it just
Well, we can certainly do whatever the insurance committee advises us to do. I would be concerned about communicating multiple years at one time, recognizing that next week is when we intend to communicate the 2014. I know that we have spoken previously about this, and we've not defined 2015. We can certainly throw something out there to say, hey, look, here, we did this. I like to make more analytical-based decisions than that, however, and I would like to see some information come back from the 2014 testing to see what needs to be our next move, because having people do something for the sake of saying we're having people do something is not an effective wellness program. Defining a program that drives behavior and addresses common issues inside of your population is an effective wellness. And we do not have a proper sample size yet to make that decision. We will once we start to gather data from 2014, but I will do whatever is asked, but I think it is a confusing message for employees to hear 2 years of wellness initiatives at one time.
I think based on some of the comments we're getting at the Board of Ed, I think we're going to have people who are going to want to know, well, what will be the time frame for the measurement for the 2015 plan year? So we're getting questions like that already.
I'll be glad to talk to the consultant about it. I have already, and I think I may have shared an email that said that he advises holding off on communication on that yet for the reasons that I've just described, but certainly I do hear you, and the message needs to be delivered as quickly as possible, and we will work towards that.
Curious, what kind of exactly what kind of questions? Melissa and her staff may be getting some questions, but from HR, we're not hearing. Are you talking about the $25 assessment or about?
Just what is my time frame in 2014 or 2015?
Because I was wondering, if that was the confusion, if we say we go all the way from the January 2013 will take me and take care of me for the 2014 year. So if I have something done on January 2014, will that take care of my 2015? I'm wondering if that's the time period that.
Yeah, and I see the issue. And I think that because of we were so eager to give such an enormous period of time to have the testing done to ensure everyone could do it, that we have somewhat backed ourselves into a situation. I don't want to have off-year cycles any longer. And an analytical decision is, let's see what our percentage looks like for January through February the 17th utilization. Let's say that we have 150 people that do their biometric screenings. Are we willing to allow those 150 people, this would be a discussion I would have with you all, to double dip, for lack of a better word, to use biometrics from that period of time to satisfy 14 and 15 so that we can get on a calendar basis? Those are the decisions, I'm saying no, but those are the decisions that we have to make. And the way to make this program effective is to simplify communication. Ideally, any wellness initiatives going forward need to be tied to premiums. We've already discussed that in last month's session. That's a credit I think you had referred to, Mr. Sandvig, and that is a much more palatable, it's a carrot versus stick approach. But our office is getting phone calls now. To answer Ms. Stevenson's question, we're not getting a lot, but we are getting calls, 4 or 5 a day right now. And those are basically, where can I go to have this done? They've heard about it, and they just want to know, where can I go to get it done? We have not heard, what am I going to have to do for 2015 yet, in our office yet. I'm sure those discussions are being had because people like to look forward, but we have not heard that I'm aware of yet. But these are certainly all plausible conversations to be had with the proper information in front of us.
Okay, so you have initiated that thought process, and I'm sure we can continue that and handle that appropriately. Anyone else have any other business? Anything else, Ms. Stinson?
No, sir, not for us.
Okay, if there's not any other business, then we are adjourned. Thank you very much.